In 2017, a group of researchers were interested in studying the food attitudes and behaviours of adolescents in New Zealand and in Tonga. Alvina Pauuvale, a New Zealand-born Tongan, led this study as part of her master's degree through the LENScience Institute. She attended Tamaki College from 2007 to 2011 and during her senior years participated in the LENScience program at the LENScience Institute. As a Year 12 student, Alvina developed a research project on human foot transmission of Kauri dieback disease that at the time resulted in changes to the way the Auckland City Council managed the control and spread of the disease at the Waitakere Ranges. She was awarded a Niwa Premier Gold Award for her research. She completed her studies at Tamaki College as the school dux and the head girl. She went on to complete a biological and environmental sciences degree at the University of Auckland in 2015. This was followed by a postgraduate qualification in Pacific Health and the first person from her immediate family to graduate from university. Her interest in exploring the science that links our early life experiences to later life health has brought her back to the LENScience Institute to pursue her master's degree. Non-communicable diseases, or NCDs, cause more sickness and disability than any other type of illness in the world. The four main types of NCDs are cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. Unhealthy diets are one of the four leading behavioral risk factors that contribute to deaths associated with NCDs. Medical and social care for people with NCDs cost the world billions of dollars each year. NCDs kill 40 million people per year. Of concern is 80% of these occur before 70 years old. These are called premature deaths and which occur most in the poor regions of the world. New Zealand, Pacific and Tongan populations are burdened with high rates of obesity and other risk factors that are likely to cause NCDs. 90% of Pacific people in New Zealand and 91% of adults in Tonga are overweight. Fruit and vegetable consumption is low across both countries, with 67% of New Zealand Pacific people and 73% of Tongan adults not achieving the recommended 2 servings of fruit and 3 servings of vegetables every day. As a result of the high rates of NCD risk within the New Zealand Pacific and the Tongan population, the research team were interested in comparing the dietary attitudes and choices of Year 9 students aged 13 to 14 years from 2 low-income environments. In addition, they wanted to map the built food environment surrounding each school. The research team led by Alvina Pauuvale consisted of experts in science, education and health. They all believed in the need for this study and together supported the data collection, analysis and provided valuable advice on how to best communicate and build on emerging evidence.
The 2 participating school communities included a school in Auckland, New Zealand and a school in Nukualofa, Tonga. The Auckland School is a co-educational secondary school located in the East Auckland suburb of Glen Innes, which had a school roll of 607 students in 2017 from Year 9 to Year 13. 68% of students identified as being of Pacific ethnicity, with 35% Tongan, 16% Samoan, 10% Cook Island, 6% Niuean, and 1% Pacific Other. The school in Nukualofa, the capital of Tonga, is also a co-educational secondary school with 1,200 students from Year 7 to Year 13. The majority of students at the Nukualofa school identified as being of Tongan ethnicity.
The team decided to use 3 sources of data to answer the research questions. The first was an in-depth student questionnaire on health attitudes, knowledge and practices conducted in both settings. The next data collection was focus group interviews with students at the Auckland school. And the last was the mapping of the food environment within a 1 kilometre radius of each school.
A total of 100 Year 9 students from the Auckland school participated in this study, which is more than 70% of the Year 9 school cohort for 2017. 81 Year 9 students from the Nukualofa school participated in this study through secondary analysis of questionnaire data collected in 2016 by the Pacific for Science and Health Literacy Project.
In the questionnaire, we asked the students about the food that they usually eat. From those questions, every student was given a diet score that represents the positive and negative qualities of their diet. We then mapped individual diet scores against their response to the question, how much does it matter what I eat? We found that students at the Auckland schools self-reported poorer food behaviours than those at the Nukualofa school. The R-squared value for the Auckland school shows that there is a strong association between student dietary behaviours and attitude. For example, those with the worst diet scores were also likely to report that what they eat does not matter very much to them. The R-squared value for Nukualofa school demonstrates a lower association between student dietary behaviours and attitude. Although Nukualofa school students have better diet scores, they are still considerably low when compared to the recommended dietary intakes for adolescents. We also use diet scores to compare against individual students' response to the question, the food I usually eat. The Auckland school students who rated the food they usually eat as being unhealthy also reported consistently poor diet scores as reflected in the associated R-squared value. However, among those that reported their food as being healthy, their associated diet scores were not as consistent. At the Nukualofa school, there is no association between self-reported rating of food quality versus diet scores, which suggests a poor understanding of healthy and unhealthy foods. We also asked students where they usually get their meals from. Majority of them reported getting their breakfast meal from home. Lunch is purchased mainly from schools across both settings. At the Auckland school, students appear to be getting general snacks such as biscuits from the home. The Nukualofa school students are sourcing their snacks from the shops. General snack and lunch meals are where students appear to be exercising greatest purchasing power and control over their food choices.
28 students who had participated in the questionnaire from the Auckland school also took part in focus groups with the researcher and peers to explore what influences the food that they eat. The responses were recorded, transcribed, coded, and themed to identify the 5 most common influences on their food choices, which included what the student wanted to eat is most likely what they are going to eat, making their own choices about the food they eat, what they see on social media, influential people such as parents and friends, and the food that is available to them. The mapping of food stores around the Auckland and the Nukualofa school were plotted using easily accessible spatial mapping tools such as Google Earth and Google Maps. This was also mapped using on-site observations. The food stores were mapped within a radius of 1 kilometre around the school, with intervals of 250, 500 and 800 metres. Food stores were identified based on the observation that they sold food. The observational assessment was then used to identify the types of foods available in each store. A criteria sheet was created to assess the types of foods available in each food outlet. The food types that made up the criteria were based on those used in the questionnaire. The food types observed were divided into 3 categories: protective foods, risk foods, and sugar-sweetened beverages. For each food category, an estimate was made of the proportion of the total food in the store in that category. 52 food stores were observed within 1 kilometre of the Auckland school, of which 70% of the food stores were categorised as very unhealthy. There are 150 food stores surrounding the Nukualofa school, with 98% categorised as very unhealthy. In comparison, there is a considerably higher number of food stores surrounding the Nukualofa school. However, contextually, these are high numbers of very unhealthy food stores surrounding both schools.
In summary, this evidence tells us dietary behaviours of students across both settings demonstrate a need for improvement. Associations between diet scores and attitudes towards nutrition and health exist. General snacks and lunch meals are where students are exercising greatest purchasing power. People, personal preference, availability, social media, and individual choice are key influences of student food behaviours. Clear differences exist between the food environments surrounding the two schools. In 2017, Alvina was invited back into participating schools to share findings with co-investigators and students. Communicating this work is important in allowing students, teachers, parents or caregivers, and researchers to access data and build on the opportunities for empowering action to improve health and well-being. We hope Alvina's research journey will inspire other young Pacific students to pursue tertiary education with the goal of improving the health and well-being of their young people and future generations.